Welcome, everybody. This is South Atlanta Injury Lawyers. This is our monthly presentation on the fourth Wednesday of every month about some aspects of nursing home litigation. Okay, so this is common nursing home infections and how to prevent them, a guide for families and residents. So this is very, very important because infections can be deadly. We'll just go ahead and get started. Why is identifying infections important? There are many, many different reasons. Number one, protecting vulnerable populations. In nursing homes, you have elderly folks, sometimes folks who are not even elderly, but were born with physical and mental deficiencies and require the care that is provided in a nursing home. So it helps protect those who are immunocompromised and they're highly susceptible to infections, and it leads to severe health complications, which we'll talk about. It also reduces mortality, early mortality. Early identification of infections can prevent bigger issues, can prevent fatalities, and it won't progress to life-threatening conditions like sepsis or pneumonia. Also, you want to prevent outbreaks of residents who may be younger or may not be as, may not have the physical ailments that other residents have. These infections can spread and cause otherwise more healthy residents to pick up infections. Also, people who visit and staff can pick up these infections as well. So you want to help prevent outbreaks. So it's very important to be able to identify these infections. It also improves the quality of care. If we don't have to think about fixing some bigger issue like an infection, maybe we can focus on the underlying issue and maybe get someone to be discharged from the nursing home. So prompt recognition of treatment can contribute to better health outcomes and overall well-being. And it minimizes healthcare costs, of course. Early intervention reduces the need for costly hospitalizations and long-term treatments. And let me just say, as I'm going through this, if anybody has any questions, feel free to raise your hands or put it in the chat, and I'll stop and answer any questions that you have. Okay. So nursing home infection prevalence. It is very, very prevalent. Nursing home infections. There is a high risk. Approximately 1 to 3 million serious infections occur each year in U.S. nursing homes. And when I was researching this presentation to put it together, that was very shocking to me. That is a lot. And if that shocks you, that's why we're doing this presentation, because it's something we all need to be aware of. So some of the common infections that we're going to talk about in this presentation are like urinary tract infections. I'll talk to you more about that. Respiratory infections like pneumonia and flu. And I think we all can think of one that has made a lot of news. I just went to go get my vaccine yesterday, the COVID-19. Gastrointestinal infections like C. difficile, which honestly, I had never really heard of before this presentation, but it's very nasty. Could be very, very a very difficult infection to resolve. And then skin infections like bed sores and cellulitis, they are very common. So the infection rate studies estimate between 5 to 10% of nursing home residents experience infections at any given time. And of course, we never really know exactly how accurate these numbers are, but it's something that we all need to look out for, because once it's reported more, we may find out that the incidents are way more than we even recognize at this time. So the prevalence, they cause increased hospitalization, which can be a death loop, So infections are leading to hospitalizations, which probably cause more infections, and round we go. And then you have, again, a very vulnerable population. If you are in a nursing home, you're probably someone who is elderly or ill. You probably have physical or mental deficiencies, which cause the prevalence of infections to just rise. So, all right. I don't see any questions. Okay. So we have an aging population, and they're in close living quarters. I don't know if you've ever visited someone in a nursing home. Sometimes there's 3 or 4 in a room. I just went to go visit an aunt of mine in a nursing home, and she had one person in the room with her, and then with me and my mother who were visiting, and the other person had company as well. It was very crowded in there. So very close living quarters, close visiting quarters. The nursing home is just like any other business. They need to get as many people in as possible in order to maximize their profits. Also, use of medical devices makes it easier to pick up these infections. You got catheters, feeding tubes, and ventilators, which are sometimes not properly maintained and used on multiple residents and not sterilized between resident uses. So you got you have a perfect environment for these infections to just run rampant. You got limited mobility of these nursing home residents. A lot of them are bedridden or immobile, and they're prone to conditions like bed sores, which can lead to sepsis and other infections. And then you got staffing challenges. If you are familiar with this industry at all, you know that there is a lot of turnover with these nursing homes. So there needs to be a lot of training, and with training and experience comes proficiency, but a lot of folks are not able to get to that level because they either will leave that facility, leave the profession altogether. So there are a lot of challenges that come with making sure that infection propensity is abated. And in different nursing homes, they have different levels of success. So let's talk about norovirus. This outbreak can happen in nursing homes, but I think we are more familiar with hearing about norovirus outbreaks on cruise ships. I've heard about it at the, if you go to the grocery store, the salad bar there, I've heard of norovirus outbreaks there as well. I have a little visual there that I'll explain in just a second. But norovirus, what is norovirus? It's very highly contagious. It causes inflammation of the stomach and intestine. It's known as acute gastroenteritis. And the symptoms are nausea, vomiting, diarrhea, stomach pain, headache, fever, or chills and muscle aches. So I just did a little quick and dirty research from the CDC. It talks about 45 outbreaks of norovirus in long-term care facilities. In Wisconsin in 2006 included 2,071 clinical cases, 44 patients were hospitalized, and 2 died. So the duration of outbreaks range from 2 to 30 days, and the median is 11 days. So that happened back in 2007. That's on the CDC website. So you can see it's something that does happen in long-term care facilities, but it's not confined just to long-term care facilities. And so this little visual is just showing you all of the impacts that norovirus can have on your body. It can have lethargy, diarrhea, and just a lot of different symptoms that can manifest from norovirus. So if you or a loved one are in a nursing home or anywhere and you have these kind of impacts or these kind of symptoms, you may just want to go ahead and get yourself tested to make sure you can get the proper treatment for it. So that's just an example. But here is our first common infection from nursing homes. This is a urinary tract infection. Most common bacterial infection in nursing homes. They occur due to indwelling catheters and bladder dysfunction. I think everybody understands what that is. So Big no, Daddy, no, you cannot share. You're asking me to share. I'm going to decline that request. So UTIs are the most common bacterial infections in nursing homes. They include pain, urination, frequent urination, fever, and confusion in older adults. And a lot of people don't understand that an infection in your bladder, your kidneys can cause confusion, but it's very, very serious. So causes: catheter use, inadequate hygiene. Prevention tips are proper catheter care. So that would be proper training by the staff who is tending to this person who has an indwelling catheter. And so just wanted to point out to you, improper care can lead to urinary tract infection. That's what we call negligence. The legal standard is what should happen in this situation. If it's falling below the standard of care, you may have a legal claim. if you find a loved one has developed a urinary tract infection. So maintaining proper hydration of the patient is very important, and promoting good hygiene can reduce the risk. I'm just going to hammer that throughout this presentation. Proper hygiene is necessary. And the dehydration can be a symptom of urinary tract infection. So you want to make sure that the patient is being hydrated. All right. Any questions on that? Okay. Well, the next is respiratory infections. I think we all had a good lesson about what respiratory infections can do in light of the COVID outbreak that we had the past 4 years. So what are respiratory infections? These include COVID-19, pneumonia, bronchitis, and flu, which can spread very quickly in communal settings, which I'm just going to encourage everyone, go ahead and get your flu shots. I got mine yesterday, so make sure you get that. It's very important. So what are the causes? We talked about this during the COVID epidemic, the pandemic that we just went through. Poor ventilation, close living quarters, folks who have weakened immune systems, and failure by the facility in implementing proper infection control measures. All of that is caused the proliferation of COVID. So prevention tips, the vaccines that I just mentioned, regular hand hygiene, make sure you're washing your hand and washing your hand the proper way, getting in between all the digits and using soap, regular health monitoring, infection control policies, avoiding crowded areas during outbreaks can also help. And pneumonia is particularly life-threatening, so much so I did another slide on pneumonia further down in this presentation. So symptoms include coughing, fever, shortness of breath. I think we all maybe have all had pneumonia, and I'm sorry, not pneumonia, have had the flu. And no, I'm sorry, I was getting confused between pneumonia and influenza. I have another slide on influenza, not on pneumonia. But pneumonia is particularly life-threatening due to weakened immune systems. So here's just a little slide on pneumonia, what it looks like, what healthy tissue looks like and what unhealthy tissue looks like. It's very, very serious and can lead to death. All right, let me know if there are any questions. Skin and soft tissue infections. Here at my law firm, this is probably what we have been seeing the most, is pressure sores, bed sores that can lead to infection, lead to sepsis, and we've had quite a few cases like that. So it's very important that if someone is prone to bed sores, that they're getting the proper care, that they're being turned the way that they need to be. And negligence in wound care is grounds for a legal claim. So I just have a little illustration here of what the skin looks like. And that breakdown in bed sores can cause a breakdown in this skin tissue. It's already 14 minutes past the hour, so I'm just going to speed up a little bit. All right, gastrointestinal infections. This is when we were talking about the norovirus and C. diff. I'm just going to call it C. diff. I'm going to give it a shot. Clostridium difficile is C. diff. So what are the causes? Contaminated food, poor hygiene. And when I looked at this illustration that I have here, you can see the virus there on the top of the skin, and it kind of penetrates the skin. That's what B is showing. And it gets all in the skin, all in the tissue, and causes death of the tissue. It causes inflammation and cell death. It's very, very serious. So the symptoms of this C. diff is diarrhea, nausea, vomiting, can lead to dehydration. So it's associated with antibiotic use, particularly problematic due to resistance to treatment. And of course, again, how do you prevent this? Safe food handling, washing hands, staff training, disinfection of surfaces, and isolation of infected individuals, because that's the whole point here. Close quarters can cause these infections to run rampant. So we want to be very, very careful about that. All right, and then we have sepsis. Sepsis is a this is actually infection of the blood. This is when your bed sores break down to the point where the infection has infiltrated. We know our skin is the biggest barrier that we have to protect us from infection. So when that breaks down, the infection, the viruses can just come right on in. So sepsis can develop from these different infections, including the bed sores that we talked about. So it's life-threatening. It's very serious. It can develop from untreated UTIs, pneumonia, and skin infection. It involves the body's extreme response to an infection, leading to tissue damage, organ failure, and ultimately could lead to death. So timely identification is important, and treatment is important in vulnerable populations, and is key to preventing sepsis. So that's what we're talking about. Nursing home residents are particularly vulnerable to this kind of infection. All right, let me just check the chat for any questions. No questions? All right, we'll continue. Now, this is the other slide that I had on the flu, influenza. It is so serious. I think we all, I'm just going to speak for, I think most people have probably had a bout of the flu. I remember the first time that I had a flu, when I coughed, I could feel it in my chest, and I knew it was different than just a regular cold. So flu, we take it for granted. Oh, I just got the flu. First of all, the virus is always mutating, because the flu virus is just like anything else. It wants to survive. So the viruses, the vaccinations that we put out, the flu virus mutates every year, so that the vaccination from last year is not going to be effective against this virus. This year's flu virus. So it's very important that you get those vaccinations every year. So influenza is a viral respiratory infection, can be severe for elderly residents. The symptoms include fever, cough, sore throat, body aches, and fatigue. So annual flu vaccination and hygiene measures like hand washing is very important. But this is why it's more important for the elderly. It can exacerbate already chronic illnesses like asthma, emphysema, heart ailments, and diabetes. So when the COVID was going around, COVID is a flu. It's a mutation. It's a flu mutation. A lot of people who had pre-existing heart conditions passed away. And that's what the flu can do. It can be a deadly infection. So we think of, oh, I'll just take a little NyQuil, I'll take a little Robitussin, whatever, and I'll just get rid of this flu. That may be true, but in some instances, if you have pre-existing conditions, it can be deadly. And not even just for the elderly, just having pre-existing conditions. But elderly who are prone to have these pre-existing conditions, having the flu could be a life or death proposition. So it can complicate bronchitis. It can exacerbate pneumonia and cause it to be deadly. If you're already dehydrated, not getting proper hydration, it could cause death. It could cause your ear infection to get it even worse, and then also your sinus infection. So I just wanted to do even though we already talked about respiratory illnesses, I wanted to do a separate slide on influenza, just so we can hammer home how important it is. So it is a very common nursing home infection that we all need to be on guard about. Okay. All right. So let's talk about the general prevention strategies. So staff training is going to be very important. We talked about that high turnover. There's not a lot that we can really do to help that, but we want to make sure that we are picking facilities who know how to train their staff properly and are constantly training and retraining. And also that goes to hygiene protocols, hand washing, and PPE, personal protective equipment. We got to make sure that the proper equipment is being used and that the environment is being regularly disinfected the way that it should. Also important, making sure that there are regular health checks of the residents. When you are picking a nursing home facility, you want to ask them these questions. How often are residents monitored? How often are they given health screenings? How often are they even viewed during the day? Not just for breakfast, lunch, and dinner, but how often are they being actually evaluated on a daily, weekly, monthly basis? Okay, so you got to stay involved with your loved one who is in a nursing home. So here are some questions to ask, just a suggestion. You want to ask, what infection protocols do you have in place when you are going to select a nursing home facility, or even if you're visiting? You may just want to commend these questions to whoever's looking after your loved one. What infection control protocols do you have in place? How do you handle outbreaks of contagious infections like norovirus or influenza or COVID? You want to ask them, what is it that you're going to do? How are you guided by the state and city and county guidelines? What are you doing? What is the vaccination policy for residents and staff? Are you administering vaccines to your staff, to your residents? What does that look like? How do you monitor and manage residents who are prone to infections? Are they isolated? Are they sequestered? If so, for how long? How does that sound to you? And it's a very, very individual question as to whether it's going to be appropriate for your loved one, whatever the answer is. But you just want to make sure you ask these questions and make sure that the staff have an answer that they can give you. What is your staffing ratio during an infection outbreak? And I am making a suggestion for you here, in case you're not aware. The suggestion is it should be one staff to at least every 3 to 5 residents, the staffing ratio that's appropriate. Then you also want to ask, what training does staff receive on infection control? And then this is very important. How do you communicate with families during an outbreak? For me, personally, if you call me, you might as well be calling it a black hole. So texting will be better for me. So you have to figure out what your preference is, communicate that to the nursing home facility, and make sure that they will communicate with you on your terms if there's an outbreak. And last but not least, I have some suggestions on how communal areas and medical equipment should be sanitized. I would suggest that you commend that question to the nursing home and the staff that's looking after your loved one. And then here are some of the suggestions. So the best practices are at least once daily. Common areas should be thoroughly cleaned at least once daily and disinfected. That is a baseline. That is just a minimum. Once every day, common areas in a nursing home should be sanitized. Multiple times a day, high-touch surfaces like doorknobs, light switches, handrails, those should be sanitized multiple times a day. And those surfaces are likely to harbor pathogens that can spread through contact. So you want to make sure those are, I would sanitize every time after use. Then again, immediately after use, areas for group activities or dining should be cleaned and disinfected immediately after each use. And I'm thinking about breakfast, lunch, and dinner. And even if there's a snack time in the morning or the afternoon, should be immediately after use sanitized. And then during an outbreak, it's suggested that the frequency should be up to several times a day for both common areas and high-touch surfaces. Helps reduce the spread of infection through indirect contact. So we know something like COVID was airborne. And so we got to make sure that we are particularly vigilant. Okay. So document everything. If you suspect below standard care for your loved one who's in a nursing home, you want to document. We have a diary that we'd be more than happy to share with you if you would like it. Just make sure that you keep detailed notes about what you are observing. You want to report the negligence to nursing home administrators and file a complaint with state regulatory agencies. I have some information for Georgia residents coming up. Seek legal advice. You can contact our office or any trusted legal advisor that you may have. And you may want to consider, I understand sometimes it's easier said than done, transferring your loved one to another facility. Okay, so here's some information about Georgia residents can use to report abuse. It is the Georgia Department of Community Health Healthcare Facility Regulation. The number is 1-800-878-6442. And then also Georgia Department of Community Health here and Adult Protective Services as well. Okay, so there are a couple of legal actions that you can take. Criminal charges, of course, in cases of severe abuse where it seems like maybe the nursing home resident is maliciously or purposely trying to harm your loved one. And then, of course, civil lawsuits where you can recover for the damages to your loved one. And there's compensation for medical expenses, damages for pain and suffering that we could recover, and also punitive damages to help future residents to not have to encounter the negligence that your loved one encountered. So what can an attorney do? An attorney like myself, in my law firm, we can investigate and gather evidence, present evidence to the court. We can represent you, and we can negotiate a settlement. So you want to look for an attorney who's experienced and has a good track record of similar cases. So here are some national resources. Of course, if you're not in Georgia, you can look in your area for resources. But here are some national resources. We got the National Consumer Voice for Quality Long-Term Care and the AARP. I think that's the American Association of Retired Persons. All right, and then of course, I already mentioned the local resources that you may have. I cannot believe how fast time is going. I just want to make sure there are no questions. Make sure to raise your hand if there are. Okay, so key takeaways. Here are the key takeaways. To be vigilant, informed about the care your loved one is receiving. So that means going to visit often. And that means asking the questions that need to be asked. And don't feel like you're ever being a nuisance. And ask the same questions over and over again until you get satisfaction. And if you don't get satisfaction, maybe consider moving your loved one. And okay, so this is the time for questions, but I don't see any. So I'm just going to go through. So here's my information. I'm Terry Fields. My law partner, Danielle Best, is here on the call as well. So here's our information. South Atlanta Injury Lawyers. The phone number is 470-WIN-4U, the number 4, WIN-4U. And this is where you can find us on social media. We're always giving out good information. And leave us, if you enjoyed this, please leave us a 5-star Google review. You can just Google our our law firm is SouthAtlantaInjuryLawyers.com. The address is down here at the bottom, SouthAtlantaInjuryLawyers.com, and just leave us a 5-star review.